Okay, we are live.
Today is Thursday, March 7th, and we are holding the Joint Finance and Auxiliary Services and Personnel Committee of the school board. We are in the upper village hall, upper level conference room, 3344/45 at West 156 North 8480 Pilgrim Road. There is a possibility that a quorum of the full membership of the Board of Education may be in attendance at board committee meetings. There will be no full board action taken at any board committee meeting. Only members of the committee may vote on any item on the agenda. A live broadcast will be streamed on the school district's YouTube page. And to watch the recorded meeting, please visit our school district of Menomonee Falls YouTube site. Can I call the meeting? I'm gonna call the meeting to order, and it is 6:31. Was the meeting properly posted?
Yes.
Okay, and we will move on to item 2, discussion items. We have a number of items. We'll start with self-funded insurance, health insurance performance. I'm gonna kick it over to Caitlin.
All right, so a few times a year we provide an update on the performance of our self-funded health insurance plan, so that's what this one is. And this is a full year summary of 2023 compared to 2022. We always kind of function looking, we're a little delayed when we have these reports from our insurance brokers. But they're a really good high-level summary of what's going on, and this one really is a full plan year. This data that we'll look at really does summarize why we had to experience some of those health plan changes that we did for the 2024 plan year. I'll start with the main point here is that our costs significantly increased despite a slight population decrease, so 3.1% member change from 2022 to 2023, but our total costs increased by 13%. And the main point here is that that's almost completely attributed to high cost claimants increasing significantly from the prior year. So 38% increase in high cost claimants, meaning over $50,000 from the prior year, whereas all other claims, non-high cost claimants, only increased by 1%. So that 38% had a huge impact on our overall performance in our plan, which is why we ultimately ended up having to resulting in the plan design change for 2024. But I will say, after all the plan design changes, it really ended up being a win for, I think it's a win-win for our staff and for our school district, because we were able to maintain premiums for I think the 6th year in a row now, and multiple years in a row. And we also were able to then add on that nice health insurance component to our health insurance to be more proactive and really ultimately remove some of those costs that would show up on our plan in a completely standalone format where we just pay a per member per month. So those are both proactive measures that we've taken to hopefully create better plan experience through our next plan year. And in the dental, absolutely. And we did a one-time HSA with the additional remaining dollars for members on our plan.
So can I ask a question about the nice stuff? So when we review vouchers, I see like the monthly expense come through. So is that factored in? I think it's like somewhere around like 8 to 10. So that was budgeted in as, hey, we're covering that. That's
Through
factored
the
in
plan
the cost
design
here.
change.
Okay.
Yeah, the plan design change brought savings that were a little bit higher than the actual increase, and so we took that little percentage extra of savings and put it into dental for EAs, into NICE for all people in the HSA.
Okay, so we
So
expected
instead
that
of like
monthly. Okay.
just saving it, I guess, which you could also do, we tried to maximize that original tiered plan savings to lower maybe what could be seen as a negative by going to a multi-tiered plan, by adding in some really great things to help kind of balance and neutralize. So it was all covered. There were no additional costs. All savings.
So we landed, despite this information, we landed in a great spot for 2024. And our plan does function on the calendar year, so.
Do we have stop loss insurance
We
that
do,
kicks
yes.
in? Did it kick in? And was there like
Oh,
a one very large claim?
We had
or-
a few very
We
large.
had a few very large
Okay.
claims.
Excellent.
I think it's at 175, is it 175 or 180?
180,
Okay,
I think we're at the 180 now.
okay.
And then just,
Keith and I had different views, I'm more risk adverse than Keith was, so I can't remember which everybody went with, but it's at like 180, but there are some other factors in there, and then quite honestly, the more you have, the worse it is for you when you go to renegotiate. Yeah.
correct. Does UMR, I don't know, like, you know, we have under 1,000 members. Do they do any type of like managing of folks that might have, like, if someone has diabetes or pregnant moms, like, do they do like outbound calls and like do like management of folks? Do they offer that level of service where they're kind of
So,
coaching people on how
those are
to-
add-ons,
Okay,
so I don't believe we have any of the, what do they call it, major illness add-ons.
condition management.
So there are things that you can purchase where they have, usually it's diabetes, it's usually not pregnancy, because that's not really illness, but it's cancer, it's diabetes, it's kidney, it's musculoskeletal, like different areas. And then it's still voluntary on the employee though.
Absolutely.
But yes, then they will get you into a program where they are managing your care across all providers. So that there's no like mismanagement of you, no meds that maybe, you know, are back and forthing, making sure that you're taking the meds, like you didn't refill it. Why didn't you refill it? Does that mean you're not taking it? So they do have that, but I don't believe we pay the additional fee for that.
I don't think so.
You're probably getting into it, but most of our cost is actually coming out of high cost prescriptions, not high cost medical procedures.
Okay.
So,
Yeah, this doesn't have that information, but
okay,
yes.
so our highest, when we get a report, and unfortunately a district like this, it could be a smidge to identifying. So we can't really share it, but we get a list of like the top 20 high cost claimants. I believe aside from like 2 infants, our top 10 are meds. They're not medical care per se, they're the med itself. So I know we looked at it with our consultants that we just don't really think we get any real return on the investment in paying for those disease management programs, because people are taking these high cost meds and it appears that like they're taking them like they should. And so we don't really think we'd have too much of a change.
I mean, I just asked a question that, like,
Yeah.
did we have, and it sounds like you guys have explored it, or
Yeah.
at least looked at it, and they've
I
kind of
will say
told
our-
you that it probably wouldn't pay off.
Yeah, it doesn't seem like it would. I mean, we can always look at it, you know, as things go on, but like our little team, I think we work really well with our consultants. To try to dig into anything we can do to make that list of 20 smaller. I mean, you're always gonna have your 20 highest, right? I mean, no matter what the number is. But our top 20 is pretty high, and it's mostly all meds. And so that's our next big tackle is meds. So, and we've already started. But the things that are out there are a little tedious for employees. So like working with your employees to get the coverage via the pharmaceutical company because they meet the income threshold to get that reduced amount. That's a lot of paperwork for people. And so, you know, some of the things that are out there aren't that great, but that's our next big tackle is RX.
And then have you had any, I know we're comparing 2022 to 2023, so I'm just wondering though, now we're, 2.5 months into 2024, as far as the NICE benefit, I mean, I'm just curious
The
what
utilization
folks
of it?
have to say about it, and yeah, the utilization on that, and
Well, I've only heard great things. We don't have a report yet. We meet monthly, so
But I think they do everything quarterly,
Yep, so they,
and then they do it quarterly and then we get it a month later,
Mhm.
so we should have it soon. I did throw it out to some principals, but I'm just gonna go to a staff meeting. Because I've been individually talking to people and they're like, oh, that's great, and then I send them an email, but nobody reads their email. So I'm just gonna go to a meeting where everybody has to put eyeballs on me and talk about it again, but everybody who's used it raves about it.
personally,
Unsolicited raving.
my goal is to get, I know the initial startup of it is a questionnaire, so like personally, my goal is to get that questionnaire done before I need it, so that when I need that first appointment, I can just schedule it, so.
Yeah, I used it and I talked to staff who are on the plan and many of them are aware of it, like, maybe they don't read their emails in depth, but they're interested in, they'll come to your prep time. Or they'll come to you, sort of thing, which they did for anybody, not just me, but they'll do for anybody. So I've done it myself, it's a great thing, and I did the RX too, which was also a cost savings because there's no deductible.
So like today I was talking to someone who knows she has a sinus infection. She knows it's gonna cost her like $300 to go to the doctor. She just telling me this. And I said, I got something for you. And so, got the app and same-day appointments are pretty hard, but next day,
Yeah.
there she goes.
Next day,
And usually, I mean, I don't exactly know what med, but those types of meds are usually also completely covered. Because they're a very generic antibiotic or something, not like special, they're very generic. So, I'm gonna check back in.
and they'll call, they'll follow up, there's a message, there's a treatment plan, and it's all on the app, there's a treatment plan on the app. And everything usually comes, like, I did a full physical and that took 2 days to get all of the data back for me. And
Labs, like real lab
Lab.
work, yeah.
they did the lab work in the office. So it's actually a great benefit, I don't think we'll be fully utilizing it this year, just because the word has gotta get out, how it works, but, my family is on the plan as well, so I'm like telling my college kids, hey, this works really well for that.
Is it just local, or like if you have a kid in Green Bay, or do they have service
They
up
have
there?
coverage area,
Okay.
so,
They can do virtual.
Okay.
but they do virtual for anybody. They do have a coverage area, and it's on their website, and you can put in where you are. And then if the color is purple, if it's purple, you're in the coverage area, and if you're not, then they can still see you virtually. And, for like a lot of things, you describe all your symptoms, you get a sinus infection every year, they probably don't even need to see you. They probably will just do that all virtually. So it's they only come to you if they really need to. But anything they can triage virtually, they handle that way.
Yeah, I have 2 college kids in 2 different parts of the state and they both used it. So,
And the nice thing is they will come here to the workplace. You just need to have a private space. And they'll come here. So that's nice, but they'll also, let's say you have 4 kids. You can make one, well, I mean, I think technically they show up as 4 appointments, but they will come to your house once and have all
That's
those appointments in a row and see all 4 of your kids at the same time and at one moment in time.
that's right.
So it's also very efficient that way. Like if you have something, like your whole family, mom, dad, and all the kids all need their preventative, check. You can have it be one visit,
Awesome.
which is,
Sometimes you have to monkey around with birth dates and
Totally
within a
awesome.
year, so that's
Yeah.
awesome.
I was impressed with it because I believe that the industry itself, that this program, they did a home visit. I mean,
sounds old school.
it sounds old school,
My mother
but
was a
they,
visiting nurse, she was, but then they
when
don't
I
have
was
to have an
born.
office or pay for the infrastructure,
Yeah,
they
so
just
people have
have.
asked me like, how do you think they save? I'm like, one, they don't have a lot of doctors. They're physician assistants and nurses and nurse practitioners
yep,
and all
that's
that.
right, yeah.
I said, so that's a savings. I said, but if you really think about it, I'm just gonna be honest, my doctor's really hard to see, I see the PA, 99% of the time, and I love her, like, so I mean, I don't have anything against, that. They also don't have any physical locations, and, cause the physical location is your house, or the virtual people are at their house.
Yeah.
So, once you remove brick and mortar, that's a huge savings. And I think they also have it just scaled down to the,
Like-
to the treatment.
Yep.
They're very efficient and, you just don't have that same level of overhead that you do when you have that brick and mortar and all that stuff. And all those higher level folks, they do have doctors. But the doctor isn't coming to your house, a nurse practitioner is likely coming to your house, maybe somebody else based on what it is, but I think it's super efficient, in how they operate. I haven't heard one negative thing yet. I've only heard positive things, so I'm hoping it stay that way. And the nice thing with like your preventive care, it's not the insurance company. So it's not like, well, it's only been 363 days, sorry, you have to wait until it's over a year. It's like, for me, like, my year kept moving, because it's like, oh, okay, it's not quite a year, but then by the time I remember to call, now instead of January, it's February, because you're not open until February. And then I try to call again in December, and it's like, nope, we're full, so now I'm in March. So like, my year's been like a sliding year my whole life, like, just comes back around. This, when I called, they didn't care when I last saw the doctor, they're seeing me. And my insurance company isn't gonna say, no, it hasn't been 366 days. So that's nice too, it's nice too.
I had the same experience.
And I'll say like on the back end of things, none of the cost goes through our insurance plan, through this experience.
Yeah.
It's complete, that's why we pay the per member, like we are literally paying a flat fee. And all of those behind the scenes costs, when you're self-funded, that every single cost matters. None of that cost is hitting our plan. So, the more the merrier.
Maybe we should wear t-shirts that says, ask me about nice.
That's me, I bet they'd give me a t-shirt.
I bet they would.
I wear it.
Hi, I know this is weird, but we need some t-shirts.
Yeah.
So we're excited. The other school districts I talked to, they said, your first year, you're not gonna see as much, but by year 2, you're gonna start to see results year 2. It kind of takes that first year for people to warm up to the idea, for enough people to start using it, for enough word of mouth to get out there for people to wanna do it and trust it. The nice thing is we're in a really good coverage area, for our folks, and our whole district is in a coverage area. So, this is the year where you try to get as many positive experiences, and then year 2, hopefully you're starting to really see those, bigger cost savings, so.
All right, are there other questions on the health insurance? Otherwise, we can move on to item B. The capital improvement plan.
Alright, so this one is, so on February 12th, our board approved our capital improvement plan. We've had a running internal document, but this is the first time it's been formally approved with our district, and we did that in conjunction with the creation of our Fund 46, which is our long-term capital improvement fund. And we will be bringing this just throughout the year, but as we have updates, or even when we don't. So right now, there are no changes that have been made to our capital improvement plan, but we're just keeping it at the forefront. Because it is a significant portion of our non-salary benefit budget. But one thing I did wanna point out is that will probably be coming with a change at some point is the cost of the high school pool. So we're not seeing that in those dollars in here yet, but we do know that it's gonna be upwards of $600,000 to just bring our high school pool up to par with wall panels and the ceiling. We know there's asbestos, so then that escalates the cost. We do know a lot of the work, we have to have the pool drained, and then you can do all of it, so that is just an increasing cost that we're working on getting actual dollars for, that will soon hit this, and then, as we do, we prioritize and reprioritize and figure out the needs, and the timing of those needs. So right now, nothing has changed, but that will be something that will probably be coming in the near future with.
So last month, we had asked about the Booster Club, and I'm just
Mhm.
wondering, Mr. Munoz said you had a chance to check in with Mr. Heimer or others about that piece of the facility plan.
Yeah, Mr. Heimer, and I know Mr. Carlton had some conversations about the Booster Club. Then we had some detailed conversations about the soccer
Press box.
press box and pricing, and we kind of left it at the pricing with, there's not a lot of existing funds right now from boosters in the community, at least at this point, is my understanding. But we have looked into it. We're not, but we're also looking at some creative options for some of those things. I mean, Chris has brought it to a few meetings, Chris Carlton has brought some of those options to a few meetings, but I don't think those have made this plan yet, I don't believe. But, we are exploring it.
More to come when we have more details and actual dollars.
Okay, so, item C is a discussion on policy 641, depository of funds.
Alright, so I did print out like the revised version, so you're seeing the yellow highlights and the strike throughs. So each of the policies that we'll go through, nothing is substantially recommended to change. The depository of funds has language that is coming from WASB regarding what's necessary, so really becoming more in line with state statute. State statute does not say that the board must adopt the public depositories for district funds and investments annually. And in fact, it says that section in yellow, bless you,
Thank you.
that once a depository is approved by the board, that unless there's an end date, that it just remains in existence until the board removes it by further action. So that's just clarifying that. I actually talked with the WASB person to make sure that was correct, and he confirmed. So using our policy resource guide, we've added that language, and that's the only change for depository of funds.
We don't need a vote on these, right? We're just sort of talking through them.
We'll talk through them and then they'll go to, Leah, do you generally have the committee approve to
So-
move to
I like
policy?
oh yeah, move to policy. I usually do like to have everybody just vote to move it to the
Move to
next
policy.
thing.
Alright,
So this would go to policy committee?
Yeah, so it would be a motion to move policy 641 to the next policy committee.
alright, would
I mean, I
anyone
can't
like
make
to make that motion?
I'll make the motion.
Alright, motion by Shelley,
Can I vote on this even though I'm not in finance?
this is a joint.
It's a joint
joint,
meeting,
so I can
all
still
of you
vote
are
on it,
voting.
okay.
So I've got a motion by Ms. Holzman, can I get a second?
I'll second.
Seconded by Mr. Wafford, all in favor say aye.
Aye.
Anyone opposed? Okay, that one moves on to policy committee.
I only do that so people don't think like I just love them.
Yeah, so I.
Please keep it moving.
Yeah. Alright, so we'll move on to item D, which is a discussion on policy 643, the gate receipts and admissions.
So this one really has very minimal changes, just to the title of the role, from business services to finance and operations. And really nothing else, because we don't have much detail in here, but I will say that we do have, just in general, our conferences generally make the decision on the prices as a conference. So this policy does say the board may review and set admission prices for district events. It's generally not a better practice, but it doesn't say must or will. So there's no harm in leaving it in that the board may, although again, it is generally by conference that the prices are set. And when there's a WIAA event, playoffs, et cetera, like the WIAA sets that, so the board would not, have the ability to set it in those instances. So, go ahead.
There's one instance where I think we're out of step, specifically with Brookfield, who's in our conference, right? It has to do with senior citizens. I don't know if we know this, but it's come up to my attention a couple times where we don't, we charge senior citizens when they come to, I wanna be clear, I don't know if it's home games or whatnot, but people are like, oh, well, when I'm a senior citizen and I go to a Brookfield game, it's free.
Oh, okay.
So for what it's worth, we may just wanna do a little refresh and check in with making sure that we're really on par with what the rest of the conferences are doing. I don't know how recent that was done.
So I talked with Mr. Highmark before this meeting, not today, but I have a note that senior citizens are free.
Alright, super, then that must have been a recent change.
Okay.
We probably within the last year or so, we were charging.
Got it, okay, so he did say that senior citizens are free, and then the student price is $1 less than our adult admission price.
So I was gonna ask, there's not really a procedure attached to this policy, at least I'm assuming currently, and since the
Right.
Booster Club handles all of this, do we think there should be a procedure, or is there maybe an informal procedure? I mean, the district staff isn't working when I'm paying to go into the basketball game, right? Like, they're lovely volunteers that we appreciate greatly. And then I'm assuming the Booster Club takes that money
So
and then transfers it to the district. So is there something written about what happens?
we have a cash management or cash handling procedure,
Mhm.
which, and policy, actually, I don't know if it's procedure, there's a policy, I'll have to confirm if there's actually a procedure with that one as well, that does get into more specifics, but we can absolutely look into the specific, gate receipt procedure as well and bring something forward if it makes sense.
Yeah, I just was thinking like, then this, I guess it doesn't matter, maybe Shelly knows because she works more concessions than I do, but like, I don't know what sort of training exists, I don't know.
There's a little bit of a transition happening this year,
Yeah.
so Amy Detloff, who has taken, at least for football boosters, I don't know what her role is on all boosters, but her son Eric is graduating this year, and so she'll pass batons, and I know that there's equipment that goes with it, et cetera, like
Yeah.
somebody bought like bill wrapping stuff or other stuff that goes with it, so it may just be beneficial to make sure that whatever's happening is
Yeah,
accounted
yeah, just to be clear, I don't have a concern, I feel like
Yeah.
there should be something written, and I don't even know that it has to be a formal procedure, but it would be good if we knew what the written piece and directions were.
Okay, we'll work with athletics to nail that down.
Okay, so, any further questions or discussion? Okay, could I get a motion to, move this policy to the policy committee, policy 643, gate receipts and admissions?
a motion.
Okay, motion by Ms. Holzman,
Sure, I'll second.
seconded by Mr. Woward, all in favor say aye. Opposed? Okay, that one moves on. Moving on to item E, discussion on policy 651.1, disbursement of funds, authorized signatures.
Disbursement of funds. So this policy describes whose signatures are required on our checks, which is not changing. The recommended additional language comes directly from WASB's policy resource guide and is reflective of the way that we make the majority of our payments, which is through either direct deposit, electronic funds transfers, or ACH, or automatic clearinghouse. And last time this policy was reviewed was 2015, and we've just come a long way as a school district and as a society in the last decade, so it makes sense that might not have been a key part of this policy, but does make sense for us to add it now. And then we also have added that additional piece about the board approving monthly hour vouchers for payments, which again, just is is already our practice, and it just codifies it into policy so that it becomes, permanent, I guess, so.
We do that more monthly.
We do it twice a month.
In the event that we only have one
Right.
meeting, I think that the monthly becomes important.
Right, cause that's what's required by law.
Well, how many months do we actually have one meeting,
Well, it could happen,
Well, it used to be two, but one
Yeah.
maybe.
1 month?
just summer.
And sometimes
It's usually
summer gets a little stronger.
Around the 4th of July and
Yeah.
around Christmas.
We've had in December.
Cause I know like, what, is it this month that we have 2 board meetings right away, back to
Yep.
back?
Right.
So why wouldn't we do that for those months?
It's been a matter of what's on the agenda, what's
I just-
needed.
Right, like we have the business meeting right after the annual meeting, and mostly that's just to, again,
Yeah,
keep
that's
vouchers,
true.
so
Right.
part of it's a matter, we try to work it in where we can, but if we're not gonna pull everybody together for 5 minutes,
Yeah,
just
like
to
if
approve
all you
vouchers.
have is vouchers, it's not really worth it.
Right.
March is the month where
Yeah.
where we don't wanna lose any meetings, cause we're trying to get all of our business done by April 8th.
Sure.
Yeah, so,
Right.
so March and April get different with the change, then technically at your org meeting, you don't necessarily need to have a whole separate board meeting if you didn't want to. It could just be an organizational meeting, cause you have an April meeting for vouchers, so.
Yeah, we have some statutory requirements with certified staff to be now in mid-April. So
Yeah.
to maximize the number of meetings in that window is extremely helpful in
Yeah.
human resources.
So just playing wordsmith.
Yep.
Do we, say at least monthly?
We could say at least monthly.
Just, I know it's a play on words, it's probably not critical, but I mean, if our policy is generally more than monthly, it's more frequent than that, then we should at least. You know what I mean?
Yep.
Small minor detail.
I was questioning the more questioning in a humorous way, so I apologize for the humor, is the start of the second sentence of facsimile signatures. As you talked about modernizing it, I was like, are we gonna really leave facsimile in there? I mean, it may be required, but
It'd be like an electronic signature?
We could say electronic signature.
yeah, I just thought that was sparked joy.
Actually, I know from the public library board that the fax machine is used quite a bit over in
Our
see-
health department uses the.
I see
All my
the,
FMLA is fax.
The
I
fax
see
is
the-
Doctor's
We
offices.
scan and email,
Yeah.
I don't know about this
Because
faxing.
fax is still considered secure.
Yep. All my FMLA is faxed to me.
Yeah,
I could
Yeah.
not, I could not have the fax.
yeah, our health department and our human services,
But
they're
electronic
high in
covers
health,
fax
or in
and
fax.
Yes.
email, so I like the electronic.
Yeah, because of the security of it, more secure than email apparently.
I was talking to
Yeah.
Nick that.
I think it's so cool it's like all.
I was gonna say, do I have to say as amended or?
You would know.
Okay.
She'll make those for policy and policy.
Okay, super. All right, any other discussion or comments? Okay, could I get a motion to move policy 651.1 disbursement of funds, authorized signatures to the policy committee?
Motion.
Motion by Ms. Holzman, seconded by
Joel Walker.
Mr. Walker, all right. All in favor say aye.
Aye.
Opposed? Okay, that one will move on
It's
as
really
well.
nice for the minutes when it's all the same people.
Yes.
Makes it easy.
It makes it easy to cut and paste all of them.
Sometimes we like to leave it spicy.
Okay, and so our last item here is to move into closed session authorized under Wisconsin State Statute 19.85 parent F to discuss considering financial, medical, social, or personal histories or disciplinary data of specific persons, preliminary consideration of specific personnel problems, or the investigation of charges against specific persons, except where parent B applies, which, if discussed in public, would be likely to have a substantial adverse effect upon the reputation of any person referred to in such histories or data or involved in such problems or investigations.
Yes.
Can I get a motion?
Motion.
All right, we've got that motion by Ms. Holzman and a second by Mr. Wappert. All in favor say aye.
Aye.
Okay, we'll cut the recording and close the doors.